Good evening, sir. I have your test results. You might want to sit down for this one because it's going to be hard for you to believe. As you said whenever you walked into the ER, you were under a lot of stress and you started having, from my knowledge, heart attack symptoms. Well, good news is that you didn't have a heart attack. Bad news is, well, you experience what is called stress cardiomyopathy. It's mostly known as broken heart syndrome. Look, I know what you're thinking. You don't necessarily have to go through a breakup or something that would, quote-unquote, break your heart to experience cardiomyopathy. All you have to do is somehow experience a huge spike of stress all of a sudden to get it. So those of the weak heart are under risk. Well, whenever somebody goes about their day normally and then experiences high levels of acute stress all of a sudden, it causes a portion of your heart muscle to weaken on one side. Thus, the reason why you experienced symptoms of a heart attack so suddenly. So, if I were you, I'd try to keep my stress down to a minimum. Do you know why you were so stressed earlier? Why do I want to know? Well, as your physician, I'd like to prevent bad things from happening to you, and if stress really almost makes you have a heart attack, that's definitely a cause for concern. Look, just because it's my job to look after you and other patients alike doesn't mean that I don't care for the welfare of my patients. That's the reason why I chose this living. It's not uncommon for me to lose sleep over my patients, especially whenever someone almost has a heart attack. So, if it's not for you, at least try to keep the stress at a minimum for me. Look, you don't have to tell me about the cause of your stress. I understand. As long as you know what caused it, you can prevent cases like this from happening in the future. So, please, just try to prevent being in that situation. Oh, I see. That's unfortunate. I'm so sorry that your significant other decided to just end things like that out of the blue. I can definitely see why you have stress cardiomyopathy now. Wow, I've never seen anybody with this condition actually have it be caused by a breakup. I'm sorry, I probably shouldn't have said that. Don't worry, this is easily treatable with a few medications I'll provide you today while you're here. But I will be needing to take more blood samples so I can make sure that you're truly alright. I want to be thorough. Besides, I want to know which medication will be best for you. Look, I know that something like this is hard to go through, especially alone. But I'm here for you, as your doctor. If you need any counseling of any sort, I'll be more than willing to refer you to one of the best psychiatrists around. Whatever I can do to help. Now, you should probably let that tired heart of yours get some rest. Sorry, too soon? I'll be right back. You want me to stay? Well, I suppose I could do more physical exams to make sure your condition hasn't worsened since the last time I've seen you. But otherwise, you're healthy as a horse. I've never seen you in this ER before, and in your records, you haven't had any other problems. No broken bones. you exercise on a normal day basis, and other than a few cases of random spouts of strep throat and the flu, I don't have any other suspicions of any underlying causes for you. So me staying here wouldn't really be necessary. But you are alright, right? Your left arm isn't hurting you, you're not having any kind of chest pain, you're not hyperventilating, are you okay? Are you having any of those symptoms? Okay, good. Well, you're not at a heart attack risk anymore. So, look, I'm sorry. I need to send out these different exam requests for you. I can't stay. I'm sorry. But hey, if you really do crave my presence that much, and if it'll help you de-stress, I suppose we could maybe hang out sometime. Well, just to make sure you're doing alright, of course. Yes, I suppose that could be a little bit taboo, but you aren't one of my everyday patients. You're just an ER patient. Well, I am a family doctor and a ER doctor, so I do see a lot of my family patients come to the ER, but I wouldn't dare actually really get involved with them other than, you know, a professional relationship like I have with you right now. Look, if you're not willing to hang out, that's okay, I understand. I just figured I'd offer since you really want me to stay here. Well, great. Actually hanging out with you, getting lunch, and not having to worry about doing my job, like getting your exam requests. I'll be happy to have your company. Anyway, I'll be off to send these requests for more tests for you. See you soon.